Hey guys, how is your NCLEX review going? Now again, I have received plenty of emails regarding the most important topics that we can and will encounter in our NCLEX exam. So I will try to give a quick overview of the things that we really have to know in order to pass your NCLEX. Now, after several surveys from recent test takers from the last 6 months, from December of 2013 and as of the recent April 2014. Basically, what I have done was I just kind of did a case study and a poll about the most common topics and questions that was commonly encountered by the majority of NCLEX exam takers, and I did this through email. And in the overall survey, basically showed that indeed infection control, as we all know, and delegation were um, two of the most important topics. As a matter of fact, we all know that management of care, right, is about 16 to 22% of the entire NCLEX exam, and that's of the current 2014. Now, if you think about it, that is really a good chunk of questions because if we kind of look at the bigger picture and let's say I'm lucky enough to get the least or the minimum number of questions in my exam, which is about 75 questions, right? That would mean that approximately 13 to 16 questions spread out, obviously, out of the 75 questions would be in relation to management and delegation. So if we have really mastered this area of the NCLEX, then obviously we can superbly do well and it can highly increase our chance of passing our NCLEX. Now, personally, I don't really look at management and delegation as something as a criteria of its own, right? Even though if the NCSBN thinks it is, which it is a particular category, but because the fact that management delegation in the NCLEX is not usually in sync with the concept of, let's say, management and delegation in regards to, let's say, a nurse manager, management delegation in the NCLEX is more of managing and planning, right, of interventions and assignments based on a client's status, right, and delegating work towards another personnel's level of competency, such as, for example, let's say delegation between you as the nurse and an LPN or let's say a CNA, right? So it's very important for us to understand that you as the registered nurse, right, will be responsible for delegating client care and supervises the implementation, obviously, of this care. Now, the NCBSN has described delegation as the act of transferring to a competent individual the authority to perform a selected nursing task in a selected situation. Okay? So basically, as the registered nurse, you are responsible for delegating client care in the supervision and implementation of the care being given. So, in order to be able to answer the management and delegation questions in the NCLEX, obviously it's very essential. It's very essential to know the guidelines for proper supervision and delegation assignments, right? So let's go over certain basic factors to remember when and what to understand in regards with delegating to our CNA or nursing assistants that we need to know in order to pass our NCLEX exam. Now, first, we need to remember that we can only relay and obviously delegate tasks to CNAs or unlicensed personnel on a chronic stable patient, right? We can only do that to a chronic stable patient. And we need to also remember that as the nurse who delegates, you would have to retain accountability for the task that's being delegated. So this basically means that the delegating nurse, which is you, would be responsible for an individualized assessment of the patient and the situational circumstances, making sure that there's a certain competence of the personnel that you are delegating the tasks to. Okay, now in regards with prioritization in the NCLEX, I want to go directly into the major important contents that you need to know for the NCLEX. And a good question to ask would be, what are the rules for prioritizing our patients? Now, a good way to be successful in the NCLEX and answering prioritization questions successfully is by kind of remembering that acute problems are more serious than chronic issues, right? So basically, a less than 24-hour post-op patient would be more serious than a a chronic medical condition or an older surgery or procedure. Now, another question that I also received from the case study that I did asks about what causes a non-priority patient to become a priority, right? Now, most common serious injuries that needs prioritization would usually include things like head trauma, especially with an increase in ICP, right, or intracranial pressure, and also usually bleedings or hemorrhages, right? So bleeding from a major artery would be very, very important and would be a priority. Again, keep in mind that we need to make sure that it's a hemorrhage from a major vessel, right? Which means it can be a life-threatening situation. Now, let's go ahead and look at infection control in the NCLEX. Now, when we were talking about safety and infection control, we need to simplify things and really understand what is safety and infection control, and basically what the NCLEX wants us to focus with this topic. Now, it's very important to realize that the safety and infection control now makes up about 10 to 14%, right, of the questions in the entire NCLEX exam. Now, if you really think about it, it's, excuse me, this is a huge part of the exam, which means that it can be a big factor for us either passing or failing the NCLEX, right? So let's simplify safety and infection control information that we need to know for this review. So first, we need to learn is to understand and simplify each category and correlate which particular diseases belongs to which precaution, right, or category of precaution. So basically, we have to know this by heart, and to do this, we really need to know the basics of each diseases. So first, let's go over standard precaution. Now, standard precautions simply are the basic level of infection control that should be used in the care of all our patients, right? Every single time. Now, basically, we use standard precautions in the care of, like I said, all our patients, and we do this to reduce the risk of transmission of obviously of microorganisms, and it's also called the universal precaution. Now, let's talk about PPE or personal protective equipment. Now, that includes the gowns, the mask, right, and the eye protection. Okay, now let's go over the meat and potatoes of safety and infection control, which is basically knowing all the necessary precautions. And like I said, you have to be successful in this category. You need to know this by heart. Now, the three main transmission-based precautions are contact precautions, droplet precautions, and airborne precautions. Okay. Again, it includes contact, droplet, and airborne. Now let's begin with contact precaution. Now it's pretty much self-explanatory in the sense that it is transmitted through usually skin-to-skin contact, right? Now the major disease that exists and enables the organism to be transferred through this type of precaution, which is contact precaution, that you will most likely encounter in your NCLEX would mostly include skin infections, right? Because obviously skin is the number one barrier during contact, right? And the four or five major diseases would include varicella zoster, herpes simplex, excuse me, impetigo, scabies, and staph infection or staphylococcus infection, right? Now, let's go on to second precaution, which is droplet precaution. Now, droplet precaution can occur from a source such as a person making a cough, right? So coughing, or sneezing, or even talking. Now, the thing with this is that these droplets that contain the microorganisms, you have to know this, is that these microorganisms can generally travel no more than 3 feet from the patient, right? And what are the main diseases that we might or will encounter in the NCLEX that would belong to our droplet precaution category? And that includes diphtheria, meningitis, mumps, pertussis, and scarlet fever. Now, I will go deeper into each one of these diseases on the NCLEX 26 online course. Now, let's go back to this review. Now, lastly, let's go over the airborne precautions. Now, with airborne precautions, there are four major diseases that you will most likely encounter in the NCLEX exam, and that would include tuberculosis, measles, which is rubiola, right? Chickenpox, which is varicella, and shingles, which is disseminated zoster. Now, the biggest thing that you have to remember in regards with, I want to go over tuberculosis really quick. In regards to tuberculosis, is that when we have a patient with TB, the patient needs a private room, and the room needs to have a negative pressure with what they call 6 to 12 air exchanges per hour. So it's basically a negative pressurized room. Okay, and what this does is it enables a ventilation system that generates negative pressure to allow airflow into the room and basically not allow the pathogens or the TB pathogens to escape outside of the room. And this is very important for you as the nurse taking care of a patient with TB to wear a special mask, which is called the N95 mask. Okay, so N95 mask would be used for our patient with TB. Now, I will go over more of the most important topics and contents that you need to know to pass your NCLEX exam in a way that is more minimalistic and simplified. And because, again, we all know that the NCLEX exam is a hard exam and one that is complex with so many variables and topics that we need to know. But instead of overwhelming our long term memory, I think we need to allow our minds to kind of retain all these information in a more productive, more cohesive way of studying. On that note, thank you so much for watching. I will be making and producing more content after this video, and I wish you the best on your NCLEX exam, and I'll always be here rooting for you guys to pass. And also, instead of paying hundreds and hundreds of dollars of your hard-earned money for other reviews, don't forget to use the All Nursing Notes Ultimate NCLEX Review, which includes a couple of the online courses, or the NCLEX 26 and the NCLEX Quickie Notes, plus the audio reviews and more videos. And it's available for only, take this, $13. It's available for only $13, and I will be donating $4 of each review sold to the American Diabetes Foundation. Um, so not only are you helping yourself pass the exam, but you are also helping out a great cause. Again, thank you so much, guys. I really, really appreciate it from the bottom of my heart. And I will see you again.